Doctor, welcome to the Pet Buzz.
Thank you.
Talk to us about Leslie's Place.
Yes, I'm happy to. So Leslie's Place is a nonprofit that I started with my husband, Dr. Mark Buffon, this past year. I am an oncologist and he's a surgeon. So we have the perfect combination of skills to do this type of work. And it's a continuation of the Penn Vet Shelter Canine Mammary Tumor Program. And the mission is to save homeless dogs with mammary tumors, to give them a better life, and also advance breast cancer research. Some of the work is translational and comparative. So that's why we gave it the name Leslie's Place. It's personal for us. It's to honor a dear friend and an extraordinary veterinarian who lost her life to breast cancer a few years back.
Do you coordinate any of that research with human research for breast cancer?
Yes, I think so. And I hope that we can do more. I think that the dog particularly offer a different insight into some of the questions regarding how breast cancer develop and progress that we can use and also learn a little bit about it in humans. And we have published some articles on that. So, and links to some of those articles are actually available on the website.
Give us some statistics about both canine and feline breast cancer.
Yes, so there's different ways of looking at incidence or reporting statistics. One is more scientific. And when you do it that way, they typically report the annual incidence rate per 100,000 animals at risk. So if you do it that way, the numbers for dogs is 200, for cats is about 25, and that compares to humans with about 100. But I think a more practical way of looking at it is to compare the incidence of breast cancer to other cancers you see in dogs and cats. And if you do it that way, breast cancer is the most common cancer in intact female dogs, and maybe the third or the fourth most common in the cat.
Is canine and feline breast cancer similar to human breast cancer?
Yes, and that's why the work we can do through Leslie's Place is so important. In general, I think that I look at it this way. So dog represents the more complete picture of breast cancer as you see it in women. So you have the diverse types of histological types and various behavior, and most of them are hormone receptor positive. In cats, you see typically a more aggressive subtype that tend to be hormone receptor negative. So in cats, it kind of represents only the most aggressive type of breast cancer you see in women, but both I think are important.
What dogs and cats are at a greater risk for getting breast cancer? And talk to us about breed, sex, age.
In both dogs and cats, it's the middle-aged to older patients that gets it. Typically, these are animals that are intact, nothing spayed, or they have been spayed at the late stage of their lives. There are, in both dogs and cats, certain breeds that are more at increased risk. So in dogs in general, you kind of think of the smaller breed dogs that are at increased risk compared to the larger breed dogs. And then typically purebred, they are probably the certain breeds I would think of would be Dachshund, Maltese, Poodles, those types of dogs. The larger ones, Springer Spaniels have been reported, as well as German Shepherds. With cats, it's the Siamese that tend to be overrepresented.
It's important when the veterinarian is dealing with their puppies and talking about spaying and neutering, that there's a reason, not just for accidental pregnancies, but there's a clear medical reason for recommending that we spay our pets.
Right. When you're thinking of preventing mammary tumors, I think it's probably one of the most effective tools that we have. And it's something that, should be considered when you have a type of dog or cat that is at risk for developing mammary tumors. That risk varies from dog to dog, but I think in those high-risk dogs, I think that's important.
I want to ask you if you can review some of the symptoms of breast cancer, because I think that's really important.
So breast cancer in dogs and cats, similar to in women, starts in the breast tissue. It's more common in the glands in the back of the body rather than the front. Starts as a small nodule. It's easy to find in both dogs and cats, and you don't really need to be a veterinarian to recognize this as something abnormal, because neither dogs or cats have a lot of glandular, like redundant glandular tissue. So you don't need a mammography to find it. You can just feel down along both chains and find it easily.
How are mammary tumors diagnosed and treated?
Typically, when a nodule is detected, we perform something called an excisional biopsy. So we don't do an incisional, which is typical in women to find out whether it's benign or malignant. We just excise the entire tumor. And that could be just as simple as a little lumpectomy to a simple resection of the gland that is affected, or sometimes multiple glands, because in dogs it's actually quite common that you have more than one tumor when they are detected. So all of that diseased or abnormal glands are resected with the first surgery. And that helps us decide whether it's benign or malignant and how malignant it is. And depends on that, we could recommend follow-up therapy. For the most part, we don't see those very aggressive types in the dogs. Many of them are hormone dependent. And because of that, if a dog is intact, we also recommend routine ovarian hysterectomy or spaying in those dogs.
That's talking about how the veterinarian or the medical community diagnoses and treating. But you mentioned that this is primarily in the aging pet. It's just like aging people, isn't it? There's certain things that we have to monitor for ourselves. And since our pet can't monitor it, we need to pay attention to monitor some of these things for our pets as they mature. Wouldn't you agree?
Definitely. I think if you have a dog that is intact or was spayed later, it's relatively easy to do those breast exams on your own pet. It's not uncomfortable. It's non-invasive. You just lay the dog over on the side and feel up along the mammary chain and in the area around the nipples. And if you find a little nodule or a knot, then you have to take your dog to a veterinarian. Many times these things happen in between those annual wellness exams. So it's important that people learn how to do that.
When I'm reviewing on an annual visit of the pets, the first thing I look at, if it's 13, 14-year-old female, has she been spayed or not? And I automatically start paying more attention to those areas. And I think most veterinarians do the same thing. And a lot of that has to do with cultural backgrounds, because a lot of the cultural events,
Cultural and regional backgrounds.
culture and regional
Yeah.
backgrounds that they've avoided, maybe for whatever reason, spaying and neutering their pets. And I see it every day. And we need to be aware of that as veterinarians. And I'm sure doctor would recommend, if she were speaking to us in a seminar, that we need to monitor that real closely too.
Yes, I agree. I think it's important. And it takes an extra little effort to feel carefully in the mammary gland, especially the caudal gland where you see more tumors. You may have to just go and feel for it specifically.
Wow. Dr. Serenmal, it's always wonderful to have you on the show. Thank you so much for joining us today.
Thank you for having me.
Thanks for viewing our content on Pet Buzz Plus.